Welcome to Dialysis. My name is KRISTIN and I'm the unit clerk at the Billings DCI. You have been diagnosed with end-stage renal disease. While this is a lifestyle change, it doesn't mean you have to quit living. Our motto at DCI is that you, the patients, are our reason for existence. So let's take a look at what your first treatment will look like.
My name is Paul Van CLEVE. I've been on dialysis about 2 years, I think. When I first started, I was in a wheelchair. Then I graduated to a walker, and now I just use my cane over there.
I've been on dialysis going on 4 years. When the techs come and get me, I go in and I weigh myself, wash my hands and wash my access, and go sit down in the chair and brace yourself.
I love it.
Just kidding.
On my first day, I wish someone had told me it was not going to be as horrible as I thought. They just went about their business quietly, and I thought, well, this isn't such a big deal.
I had a fear of it hurting really bad. I didn't know much about dialysis when I started, but once they started using the needles, it hurt a little bit until I started getting scar tissue, and while I was on the machine, it didn't hurt.
No, my first treatment in dialysis wasn't a bit painful. I had taken a tour of this dialysis center earlier. Scared the hell out of me. And when I actually came to take dialysis, it was just a piece of cake, and it's been that since.
When I was younger, I used to be a heavy smoker, but I don't do that now. But, and there's things like that I got to be very careful of. So, there's limitations, but, there's ways of, being cautious and being careful that you can still do those, and it's nice.
Oh, I think I can live my daily schedule as it is now with dialysis.
I felt a lot better after I started dialysis within the first couple weeks. I had a lot of fluid on, and they were able to get me feeling better again.
Dialysis has helped me generally feel more comfortable, and I'm very satisfied with it.
My daily life, the restrictions I have is not now during the summer, it's liquids, and it's kind of more being careful, so it's okay. I gotta limit myself in my fluids, and hot weather now, in ways it's nice, if it's not fluid. And I got ice that helps me, popsicles. Oh.
The staff goes out of their way here to make me comfortable. I will say you meet some very interesting people here, staff as well as patients.
I have missed treatments before. I feel really bad after I miss a treatment. I fill up with fluid, and it's hard to breathe, and my legs swell up really bad, so it's hard to walk, and it's not a good idea to skip treatments.
Other than being sort of immobile, it doesn't feel any particular problem. There's no pain. Actually, I tend to go to sleep if I'm not watching television.
I watch the Food Network, and I just sit there and watch TV, or I take a nap.
The chairs are comfortable. Some people bring a pillow to put their arm on, but I've found the chairs are comfortable enough.
I feel really good now that I've started dialysis. Before I would get really sick, and I had a lot of fluid on me, and I was happy to start dialysis.
We keep a sterile environment for our patients, so our techs and nurses will be wearing white coats at all times. While our techs are trained to help prepare and monitor your treatment, our licensed nurses are over your entire care and medications. Make sure that you use the restroom before your treatment so that we don't have to stop the machine in the middle of your treatment. This can affect how adequate your dialysis is for the day. Before you go into the unit, make sure you have things that will make you comfortable. Here at Billings DCI, we have several nurses and techs to assist you during your treatment. Let's introduce you.
My name is Wayne Staley. I am a clinically certified hemodialysis technician. I am just one of the techs here. I will be bringing you in on your first day, and I will have you weigh, wash your access and your hands. I will bring you to your chair, take your blood pressure, temperature, collect all your vitals, get you ready for the nurse, get you all settled in with your blankets, take care of your machine, get your machine programmed. After all that's taken care of, I'll pass you off to the RN and she will put you on.
My name is Angie Mickelsen, and I am one of the charge nurses. Assessments are done before and after treatment by a nurse. We will listen to your lungs, your heart rate, we'll check your legs, ask you if you feel like you have any swelling. We're trying to assess you for how much fluid that we should program the machine for. We want to know how much you weigh when you first start, and then we'll compare that weight from your previous weight or your dry weight. A dry weight is an estimate of what we feel like you would be with, say, your kidneys were adequately getting rid of fluid. So your dry weight's what we want you to leave at when you leave. We want to listen to your lungs before and after treatment. If your lungs have like crackles or if you're wheezy, that could be a sign that you've got extra fluid on. And then we listen to it afterward, after your treatment, and sometimes your lungs will sound better, and then we can tell that we've removed an appropriate amount of fluid.
As a social worker, I help the patients with their insurance and financial needs. I also help with Medicare and Medicaid and other things like that. I try to do those things so they don't have to deal with them on their own.
The symptoms the patient should alert the staff to while they're getting dialysis would be cramping anywhere. Some patients will cramp in legs or abdomen, in their back. If they start feeling dizzy or lightheaded, some patients may want to know why they have to have a fistula instead of using just your veins. With a fistula, it's a vein that's connected to an artery, so the artery allows more blood flow through the fistula. So we're able to process your blood longer, faster.
Along with the labs, I also do vascular access. Your fistula, your catheter, whatever it is, that's your lifeline. That is your lifeline. You have to take care of it. Just don't let people take blood pressures on that side. Don't let people draw blood on that side.
If this is your first dialysis treatment, your treatment time is typically shorter than what your normal treatment time will be. A lot of patients will start out with a 2-hour treatment, the first treatment, and then 2.5 hours the second treatment, and then 3 hours the third treatment. Expect your dialysis treatment to last anywhere from 3 to 4 hours, depending on how well we are able to clean the toxins out of your blood. Or if you put on too much fluid in between treatments, sometimes the physicians will need to extend your treatment time so that we're able to pull more fluid off.
I want you to feel comfortable asking questions to people like me that aren't a part of your care while you're on the floor. Yes, I'm in and out, but that doesn't mean that I'm not here for you just as much as anybody else. So I want you to feel free to ask anybody, any questions that you might have or anything that we can do to make you more comfortable here. We're trained, we're experienced, and we have the knowledge to help you.
The anxiety level even after the first treatment is way down. Almost every patient that's come into dialysis that hasn't come on the unit before to even look around are very anxious and nervous and scared, and that's very normal. One of the first things we do when you come in is we'll do your weigh and wash your hands and wash your fistula at the sink. we'll check your blood pressure standing and sitting, and the nurse will listen to your lungs and your heart, and then ask and assess if you have any swelling or anywhere that you've noticed, so, and how you're breathing. So, how are you doing today, Stephen?
Doing good. Doing great.
Good. Any shortness of breath or anything? No. Good. Do you mind if I listen to your lungs?
Please.
Okay. Listen in the back here. Sound good? Take a listen to your heart. And we'll take a look at his fistula here. And you can feel the blood whooshing through. Also listen to it with the stethoscope so we can hear it. We're listening for any whistling, any different sounding. We don't want to hear like a pulsation sound. You want to hear a whoosh, whoosh. And Stephen, you listen to yours at home also, don't you?
All the time.
All the time, good.
I always feel it too to make sure it's moving.
Yeah.
Right there. It's just a thumping.
Yeah, that's good. And then if you ever come, like wake up in the morning and you can't feel anything or you don't hear anything, you want to call the clinic if we're open, or go to the emergency room right away, because we want to get that blood flowing back through, and the physicians or doctor will probably have to do a procedure to get that clot out if it's clotted off. So.
No big deal.
Yeah. So we have different ways to clean your fistula. Most of the patients use the chlorhexidine swabs. We have some, if they have an allergy to that, we can use Accept or alcohol. We have different stuff we can try. Typically the first stuff we'll use is the swabs though. So. It's really important that during your treatment you don't cover your access arm or your lines at all. The staff need to be able to monitor that to make sure that one of your needles doesn't get dislodged or the tape doesn't get stuck on your blanket or anything. Okay, so we're gonna lead the blood down to the end of the tube, and then we flush it with a little saline, and it might feel a little cold, but it should not burn or hurt, and if it does, let us know right away, because that can mean the needle might just not be in the right place and we might need to adjust it a little bit. Some patients will get heparin during their treatment. Stephen doesn't get any heparin. That just helps prevent the clotting through the system while we're doing dialysis, so you don't lose red blood cells. So I'm just going to double check that all the parameters and everything is set appropriately to the physician prescription. And his weight's been calculated already. And everything looks good. And then we have a couple chambers here on the machine. We're going to check to make sure that they're full. Now we're going to connect, yep. So I'm going to start the pump, and you can actually watch the blood flow through the arterial line, the bottom needle. We're taking the blood that has the waste products and the extra fluid in, and it's going through this chamber, and it goes through here and up through your kidney. They call it the dialyzer. So this will clean your blood and pull fluid out. And then after it goes through the dialyzer, it comes back up here and it goes through this chamber, and then you'll see it come back through you, and there's saline in this whole system. The machines beep a lot, so don't be afraid. They're very noisy sometimes. The first beeping says it detected blood in here, so you've officially started your time for treatment.
Dialysis is a lifestyle change, but you don't have to stop living. At DCI, our goal is to make your transition to dialysis as smooth as possible. We look forward to assisting you with your continued care. See you soon!